Hi, I'm Maria Pfrommer, Director of Nursing Education at Osmosis from Elsevier, welcoming you to Raise the Line, an ongoing exploration about how to improve health and healthcare. I'm pleased to help raise the line today by introducing you to Dr. Pamela Jeffries, the Dean and Valere Hodder Professor at Vanderbilt School of Nursing. Dr. Jeffries is internationally known as one of the pioneers using simulation and high-fidelity simulation models to prepare healthcare students for clinical. Dr. Jeffries is also known for her work integrating educational technologies and improving the online learning landscape in nursing education. Dr. Jeffries was formerly the Dean of George Washington University School of Nursing, the first Vice President of Digital Initiatives at Johns Hopkins University, and the Associate Dean for Academic Affairs at Johns Hopkins University School of Nursing. Among her many other credentials, she's a fellow of the American Academy of Nursing and a member of the Institute of Medicine's Global Interprofessional Educational Forum. I know that's a mouthful. I would like to thank you so much for joining us, Dr. Jeffries.
Thank you.
I've been following your career as an educator since the early days of simulation. You have a fascinating career trajectory. I'd like to start by learning more about you and what first got you interested, say, in healthcare and particularly nursing.
Well, thanks for the question. So that goes back decades. As within a young high school student, you've got to make a career choice. Do you go to college? Do you not? Of course, I wanted to excel and go to college and get, that was going to be my career path, but I was uncertain what to do. But fortunately, I'm more service-oriented. I wanted to be around people. I became interested in the hospital environment because my best friend was my neighbor, and her father was in the hospital a lot, and I'd go to the hospital with her to see her father. And I was always intrigued by the busy hospital environment, the nurses, the care of patients, the compassionate care, and that led me into nursing.
Very interesting. I saw, too, in your early clinical experience, you were in critical care. What drew you to that unit and that type of work?
I'm from a small community in central Indiana, and I went to Ball State University for my undergrad. I came back home because I had a small scholarship, but I had to work in my community. And I chose a regional hospital. At the time, I was on a medical surgical floor. And I remember my first position, they gave me 42 patients in charge of a whole unit. But I grew to love the unit. I had some great support from that regional hospital. But I ended up moving to critical care because I love the fast pace. But the critical care within the central Indiana, we had a lot of heart patients, cardiovascular. It's an agricultural area, a lot of farmers, a lot of industry type workers. But I grew to love the cardiovascular. It was more on the medical side. And then I went on from the regional hospital in central Indiana to Indianapolis. At the time it was Methodist Hospital. Now it's IU Health. And then I got to take care of the advanced care of those patients that had, cardiac caths, post-cardiac cath, all of that. And still love my cardiovascular patients. And so I pivoted when I went to the academic career. I left, I was full-time on the practice side and then went full-time academic and PRN on the practice, but never forgot about the cardiovascular patients, the families, and the community.
Interesting. What got you into academia?
So that was interesting. It was unexpected. I did not have my full trajectory in my mind when I started to be a nurse. It was interesting. I was working on my master's in Indianapolis at IU, Indiana University School of Nursing, and working in critical care, Methodist Hospital. And there was a part-time cardiovascular position that came open to teach cardiovascular in a med-surg course. And it was going to be part-time. I thought, well, I'll dip my toe in the water. I'll see what that's like. But anyway, the part-time ended up being a full-time position, which I interviewed. I got the job. So I made the shift, went into the academic area full-time and just still worked PRN. And once I got in the academic environment, I just loved it. I loved impacting the next generation of students, really helping them to formulate what our profession was like, setting them on the right stage. I felt just a great contribution to our profession and preparing, those students. And I ended up teaching across all programs, whether it was pre-licensure, master's, PhD, but just love the environment, the enthusiasm, the generation of new knowledge and discovery of new knowledge, through our doctoral programs. And I never turned back. I still love the academic environment. And then, by 2009, I became more of a formal leader, I guess. At IU, I became an associate dean for undergraduate programs, which started my leadership journey.
Wow, that's awesome. And then here you are now at Vanderbilt. Can you give us like an overview of that nursing program and what are you thinking? Like what's innovative now at Vanderbilt?
So thank you for asking about that. Really proud to be at Vanderbilt School of Nursing and leading the charge as dean here. I'm starting my 4th year. Believe it or not, I've accomplished 3 years. And I was recruited here. Once Dean Linda Norman retired, they were on a search, and I was in the Virginia, Washington, D.C. area. But I liked, I always heard about Vanderbilt and the elite school it is, and, the high rankings and the wonderful programs, faculty, and staff they have. So coming here at Vanderbilt, in fact, it's exceeded my expectations. The support and services we provide our students each and every day, our faculty are rock stars, and staff, I feel we just have such a wonderful team. The strengths at Vanderbilt, if you look at the School of Nursing, we have 14 specialties in the nurse practitioner program. So we create that expert education for nurse practitioners. If you look at our U.S. News World Rankings, we're number 4 in the MSN programs. When I came in, we were 8, and we went 6, and now number 4. In addition, our specialties, we're number 1 in midwifery. We're either ranked 1, 2, or 3 in psych, in pediatric community care, whatever that may be. FNP's high. So we rank high, but that's a testament and demonstration of our excellent faculty and excellent education that's given. In addition, we have a strong research program and growing that, contributing to the greater VU at Vanderbilt. Vanderbilt as a whole, we're number 10 ranked in NIH funding, and every year we have been exceeding our research goals. So I love the climb, the propelling forward and creating research scientists. And we are getting ready to create a nurse anesthesia pathway for our DNP.
Exciting.
It is exciting because in about, within 5 years, 35% of the CRNAs will be retiring. So we need to give back to our community and produce that workforce. And we are working closely with Vanderbilt Medical Center. They need CRNAs. So we are doing that and just hired our new director. So lots going on at Vanderbilt, whether it's in innovation, creativity, our programs. And one last thing, we've created a professional development arm and are doing micro learnings and micro credentialing, giving CE, we're a CE provider now, and growing, using our intellectual capacity to expand in professional development.
Oh, that is excellent. Such great programs there. I remember meeting Dr. Norman at one of the conferences, and she had heard, I guess I was just finishing up my DNP. I got my DNP at Duke and my PhD online, and she was interested in interviewing me for, I forget what it was now, just a faculty position. She was thinking about a program, a dual doctorate program at the time. How about simulation? Obviously, with you being the pioneer in simulation, how are you using simulation at Vanderbilt?
So thank you for asking. We have a wonderful simulation center led by Dr. Joelle Unhold, our simulation director. And we have a team of simulationists and SimOps and all that. Our faculty have really embraced simulations here at Vanderbilt. In fact, our MN master's entry, they're incorporating quite a bit % of simulations into the curriculum, which of course I am fond of. I believe in that experiential learning and creating a safe, non-threatening space where our students can practice even before they go out in real practice. We also have we're looking at innovations. We've created a space. It's got a mind lab. So we're looking at using a lot of VR. We've got holograms we're looking. But that's kind of the wave of the future is, using those ocular lenses, the VR, the immersion experiences. So continually working on that in addition to virtual simulations where you can do just in time, any place. Even with our hybrid students, sometimes, they can learn at their kitchen table versus coming in. And they do come for immersive experiences here in Nashville. The simulation is here to stay now that we've moved to competency-based education and outcomes. I feel simulation is one of those tools, one of the mechanisms that's going to help for faculty to see our students demonstrate those competencies needed across those domains. But simulations are great. We continue to add more and more. In fact, just like everybody else, our space is tight, and we're looking at alternative times and more space needed to continue to integrate into simulations, not just in the MM, but across our NP specialties as well.
I was just thinking that with the CRNA program and even in the NP program, I've been directing nurse practitioner programs for a while now. And we have that skill sets that, we need, especially the acute care certified. And now, like you're saying, with the CRNA, I mean, can you imagine intubating someone for the first time without having simulation? And I think you were responsible for a lot of that implementation back in the day when it was all about educating the educator on the value of simulation.
Yep.
But even so, like in that same kind of line, if you will, long before COVID, I can remember you talking about online learning. What role do you feel online learning is playing today in nursing education? And do you think the teaching and the learning experience is better than it used to be?
So thank you for that question. Of course, I've always been an advocate for online learning because it provides educational mobility for many. If we didn't have online learning, some people can't just uproot and go, to a university or propel their educational career forward. I believe COVID, I mean, there were not a lot of positive things with COVID, but one thing it did do was propel online virtual learning forward because you had to. Even with telehealth on the healthcare side, we just had to do what we needed to do to progress our students. But that online learning, people had to pivot if they didn't. Luckily, I was at George Washington University at the time, and we had a pretty substantial online program and had everything together. But the programs that didn't, they had to really move quickly to move that. But online learning, I think, for nursing education is so important because if you look at our students, even when they're full-time students, are still working part-time, sometimes full-time and going to school part-time because they have families, they're breadwinners, whatever that may be. So they're doing what they can to get their education or to advance their career with a master's, DMP, or PhD. So online learning provides that flexibility, adaptability. And I know I've taught many online courses, developed online courses, and a lot of times with our nursing population, you'll see a lot of the educational activity at nighttime when the children are in bed or on the weekend when they have the time. But that's okay. You do what you can when you can to, get your degree and to advance your career. So online learning is here to stay. I think we've advanced the best practices. They've been identified more and using more. I know anytime when you go, we look at national benchmarks like Quality Matters. Those benchmarks are national standards that we try to meet. So there's best practices, there's standards, high quality benchmarks. So when you adhere to those, you're doing a good job in providing that excellent education via online learning.
Well, thank you for all you've done between the online learning and the simulation and all of the knowledge you have shared with the nursing education community and bringing that forward. I think there's a lot of people that really couldn't even accomplish an education without having those two modalities. And I'm kind of interested too to see, because you're always cutting edge with the new pedagogies. Is there something on your radar that you see developing that you think could impact nursing education in the future? Like AI?
AI is definitely a game changer with the new pedagogies and the use of AI. It's not only game changing now, but in the future, we don't even know what that looks like. The technology is advancing quicker than we can even embrace and get a handle. But AI, our students are using it. Now faculty have to, how are we going to use it best? But in the world of education, you can look at practice tests. You can, develop outlines for lectures. You can do so many things, create practice tests. Students are creating practice tests using AI. Simulation scenarios you can use AI in to create. But the caveat is, there's still potential error in some of those AI development pieces. So you got to make sure you peer review, you look for accuracy before you put it out there. But it's certainly a more efficient time-wise. When using AI, things can go quicker. I know here at Vanderbilt, we have embraced AI. In fact, I think there's a vice chancellor for AI now at the university level. We're creating an AI council here at the School of Nursing because, it's almost getting ahead of us because not only is the use and the operations of AI, but what are those ethical considerations that we need to look at? And those are changing almost every day, but we have to stay upon it. And here at Vanderbilt, we also created our own, you've heard of Chat GPT, whatever that might be. And Vanderbilt has created their own internally. It's called Amplify. But we can put documents and all that, and it's safer to use. It's not in the worldwide cloud somewhere, but within our own Vanderbilt. And not that we're putting confidential information in it or anything, but we've got our own portal for that. And the use of it is it's going to continue to grow. What that looks like, who's to know? I feel we're already behind in it. The technologies are ahead of us.
That's very interesting. Yeah, same here with the publishing world. In fact, I work with a team that creates Osmosis videos, and we love to fill in knowledge gaps. Is there a topic you think Osmosis should make a video about to fill a gap that is particularly of interest or concern to you?
Well, just what we talked about, if you're going to do a video, using the uses of AI in nursing education would be important, not only in, education from the educator's view, meaning helping with my lectures, helping with clinical education, and maybe even finding clinical spots. There's so many opportunities to use AI or in simulations, but then you flip it to the student side. How are we going to advocate for students using AI? What are those? Where should we foster the use of AI with our students? Because it's here. It's going to be used. I use the analogy. Remember back in the day, I don't know, you may not, but when we used to do medication dose calculations and we didn't want students to use calculators because they had to do the math, and we had to make sure they knew the math. And of course now, everybody uses calculators. You're run more risk to use hand formulas versus the calculator. So we have to pivot. We have to be relevant in our practices of what we're doing. And now, AI is being used all over. I've got a Chat GPT app on my phone. I can ask questions, do whatever. But if you're going to do a video, I think using those types of technologies, because the advanced technologies are coming quicker than we can really probably spell them and use them and know how to do it.
Thank you so much. I really appreciate your insights. We have many students and early career health professionals in our audience. What's your advice to them about meeting the challenges of this moment and approaching their career in healthcare?
Well, first of all, I would tell students who have a career or approaching a career choice in healthcare is congratulations. What a great choice they've made, whatever that is. I happen to represent nursing, but if it's medicine, it's physician assistant, it's social work, it's whatever that is, congratulations. It's such a rewarding, valuable career. I'll speak for nursing. We're the number one healthcare workforce. We're the largest workforce, over 4 million. We're with our patients 24/7. But I can't describe anything probably more valuable than caring for patients and, promoting health and, getting the patients and their families and the communities back on par, because nothing's more valuable than your health, right? Also, I would tell the health profession students to enjoy the journey. It is hard. If it wasn't hard, everybody would be doing it. But it's a rewarding career. It's very service-oriented of helping others. And it is a hard journey, but just embrace every step. And if something you don't understand, you need to see your faculty. You need to see your person who's overseeing the orientation on the clinical unit, whatever that may be. Because nobody wants to be mediocre. You want to be the top of your game in whatever that health profession career is, whether it's great physician, great nurse practitioner, whatever. But enjoy the journey, and it's very rewarding.
Well, thank you. And thank you for helping us lead the way with your leadership. Thank you very much, Dr. Jeffries, for being with us today.
Thank you.
I'm Maria Pfrommer. Thank you for checking out today's show. Remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelines podcast.